Hi, this is Mark Bates. So, in this blog post, I'm going to talk about drivers of chronic disease and metabolic health. And there's an article by Dr. Avi Herskovitz, who we're pulling a lot of this data from. So, uh, Dr. Herskovitz is an expert in integrative medicine, which is very important because that's a style of medicine that tries to look at the whole body versus allopathic medicine, which looks at individual body parts only. And so he becomes an expert, in my mind, of somebody who's in our path of looking for root causes for chronic diseases and metabolic health. Um, your allopathic doctor is a great person. He's great for doing what they're trained to do, but they don't look at root causes for the entire body system, and that's where integrative medicine really helps. Okay, one of his big concerns, of course, is the leaky gut and the cause of the microbiome. That's your gut microbiome, right? And the issue here is that, of course, he talks a great deal here about how the gut microbiome and intestinal permeability, that's leaky gut, causes a great deal of the disruption we have. And I see that with all of my clients. Almost everyone who's eating a sad standard American diet food will have leaky gut. I mean, it's a guarantee. Now, it's good. I've told people, yeah, I could run a test on you. The test costs $400 or $500, depending on what we're looking for, and it'll prove what you have. But I'm going to tell you right now, you probably have it. I mean, there's just no way around it. If you're eating, just the normal garbage that comes from the standard American diet, you're going to get this. And this leaky gut causes a disruption in your gut microbiome, which causes all kinds of problems, right? And the big one here uh, is this idea of elevated levels of bacterial endotoxins get into the bloodstream, and then your body's actually fighting your own gut, which is not good. I mean, so this happens, and so what happens is this causes systematic uh, inflammation, and inflammation's bad, right, for your body, and this is where you get a lot of your uh, issues with metabolic disease, and you see all kinds of chronic diseases come from this. So cancer, autoimmune disorders, metabolic diseases, that's like type 2 diabetes, weight gain, things like that. So this is very important. We want to make sure that we're taking care of this. Okay, so the big thing here, and once again, these harmful bacteria. I've run several of these stool samples of the gut microbiome, and they all show that you have elevated amounts of harmful bacteria. And uh, like I said, they're $400 or $500. I just don't see a reason to do that when I can pretty much guarantee you it's there. And just a simple change in your diet can certainly help with that, right? Uh, Probiotic and prebiotic supplementation can certainly help. Now, one of the things I don't normally recommend is that the average probiotic that's out there, if you're taking a supplementation, contains a lot of lactobacillus, which is the bacteria that you make yogurt from. And I'm finding a lot of my clients who want to run the test, they have an excess amount of lactobacillus, which at a good level is very helpful. At too high of a level, it becomes problematic. So you got to watch out for that. And then one thing that is talked about a lot, and I talk about this, stress management. Stress is a big part of your lifestyle and reducing your inflammation. And so you need to do that. Part of the big help, of course, getting adequate sleep, getting regular physical activity. You don't have to be, a gym rat, but just go out and walk a little bit. I like gentle walks in the morning, especially like right after eating. You eat a meal and just take a little walk around the block or something. These all help a great deal, right? And yes, you can monitor all this stuff. There are tests we can do. They're very costly. I don't see the need for them when I can pretty much guarantee you, unless you've been on a good optimal health diet for several months, you're going to have leaky gut problems. Okay, that's almost a guarantee. Now, I found this very interesting. That once again, according to his research, right, 85% of Americans have a metabolic syndrome problem, right? And I've been saying 88%. It varies upon which research you're looking at, right? 75% have endocrine disrupting chemicals in their body. Now, this is a big one because this is part of the lifestyle. You've got plastics, you've got phytosterols coming from plants. These all cause all kinds of problems. Microbiome imbalances, that's in your gut. You've got bad bacteria overrunning the good bacteria, and there are ways of fixing that, right? And then, of course, if you have this, you have a lot of leaky gut, right? And leaky gut is where the bacteria is actually getting through the cell walls right into the bloodstream. And this is all bad. So we want to get rid of this stuff. Okay, early detection. So remember, we're looking for things like toenail fungus, overweight, bloating. If you look at your biomarkers, prompt intervention. Well, yeah, change your diet, right? Because you don't want diseases like Alzheimer's. Except biomarkers, and this is the thing: oxidative stress. If you're taking a blood test, CRP levels will show a great deal there. But just mitochondrial health. If you're lacking energy, if you have excess weight on you, if you have some brain fog, these are all biomarkers associated with this. So that just tells you got to change your diet. That's the best place to get this, right? And now, one of his specialties is going after cancers, and he talks about tumor genomics for this, and then we'll talk about that in just a minute. But genomics has also a big part in what we're doing in terms of trying to get healthy. Okay, two big things he looks for: oxidative stress and immune function. Obviously, I'd look for some others as well, but these are key. The stress, oxidative stress, that's your whole body stress, and diet has a big part of that. If you're in the course, I'll talk a lot about eating properly reduces the appearance of reactive oxygen species. That's ROSs. These are the key level of oxidative stress in the body that comes from burning too much of the wrong fuel. Okay? And finally, Dr. Herskowitz talks a lot about how all this stuff deals with cancer. Cancer is, in his mind, and in my mind as well, but he's the doctor, is a lot more of a metabolic disease than is anything else. Very few cancers are caused by viruses and bacteria. They're caused by chronic functions. The research seems to show that. And one of the best ways to treat cancer, in addition to getting your normal cancer treatment. So if you have cancer, please keep going to your doctor and take the normal prescribed medications that they're telling you to take. But the best way to treat cancer is not to get it in the first place. And the best way not to get it is to eat a proper metabolic healthy diet. So that's the blog post for today.